Hi, my name is Rebecca Whitlock, and today I'm going to be doing my health assessment vital signs video. So the first thing we're going to do is we're going to start off by washing your hands. You're going to take all your rings off and your watches or any jewelry you have. And what I'm going to do is I'm going to wash my hands for either 30 seconds or sing happy birthday twice with warm soap and water. Okay, I'm going to properly dry my hands too. Alright, next up, let's go in to see our patient. Come with me. Our patient is a 19-year-old male, and he's coming in for checkups. Let's go say hi. Hello, how are you?
Well, how are you?
I'm good. Are you Christian?
I am.
Okay, so what are you in here for today, Christian?
Checkup.
Okay. So let's start off with some health history. So, do you have any allergies?
Nope.
Okay. Do you have any family history of like cardiovascular disease or hypertension?
No.
No. Have you had any recent surgeries or injuries?
No.
And do you want to look at anything specifically today?
No.
Okay. Nothing's bothering you?
No.
No? Okay. Sounds good. Let's get started. What we're going to do first is check his height and weight. What we're going to do is we're going to stand up, and next to this, your heels are going to be up against the wall, feet straight, stand straight up. And what we're going to do is, get this all the way back and then like this. Okay? Looks like he is about 6 feet and 2 inches. Next, we're going to weigh him. And what we're going to do is we're going to step on the scale, take off your shoes, and just stand straight. And feet together. Feet together. And, yeah. So, let's check it. Looks like about 195 pounds. Okay. Alright, let's sit down. It's time to take your temperature. Okay, so what we're going to do is take your temperature. I'm going to take it in your inner ear. So we're just going to stick it in. Alright, looks like it's about 98.6. That's the golden standard. Normally temperature, the normal ranges are 96.4 to 99.1 Fahrenheit. So next what we're going to do is we're going to check the pulse of our patient Christian. So I'm going to take his radial pulse. There's a bunch of different pulses that you can check in the body, but this is the one we're going to check today.
I like that idea.
So we're going to, alright, a little talkative. We're going to check the radial pulse right here. I'm going to take my index finger and my middle finger and wrap it around. Okay, so as I am taking the pulse rate 2 for the 30 seconds, and then I'm going to multiply it by 2, I'm also going to be looking at our patient's respiratory rate. We do this just so, if we tell them we're looking at their rate of breathing, it might alter, and their patterns and stuff, so we just want to keep it as normal as possible. Okay, let's start taking his pulse. Yes. Thank you.
Welcome. Nurse Whitlock.
Bless you.
Thank you.
Okay, so his pulse ended up being 33 during 30 seconds, so we're going to multiply that 2 and get 66, which is perfect because the regular range is about 60 to 100 for pulse rate. We also need to note that his pulse was about a 2+, which was a very nice beat. It was evenly irregular, which is what we would say. If it was where we could barely feel it, it would also be known as thready. That would be a 1+. Or on the opposite side, it would be bounding and out and it's really strong. That would be a 3+, and it wasn't either of those. It was a 2+, so which is nice and healthy. Also, the elasticity of his veins was perfect. If it's hard, the blood would be harder to get through. His was nice and spongy consistency, so he was good there. Okay, so also his we were doing his respiratory rate. We were measuring that. His respiratory rate was 11. I counted. The normal range is about from 10 to 20, so he was good there. He had symmetrical chest expansion. His positioning was good. He wasn't hunchbacked in the tripod position, which is also oftentimes what we see in COPD patients. So that's good. All that seems pretty standard. Okay, so next we're going to do the blood pressure reading. I'm going to get out of my handy-dandy nursing fanny pack, which I never leave the house without, and get my blood pressure cuff out to get this blood pressure reading. It's really important to do this right. So we need the patient's feet flat on the floor and make sure when we're putting his cuff on, one, that his arm is like table length with his palm up. And we also need to make sure we have the right size cuff. For him, we'll use a regular cuff. Sometimes when the cuff is too small, it might have a false high reading. And if it's too big, it might have a false low reading. With obese patients, we'll usually put a bigger cuff on, and with kids, there's always smaller ones. So this is going to be a regular size. We're going to put this on. It's going to be 1 inch above the brachial, or 2 fingers measured. So we're going to put this on. It's going to be 60% of the bicep from the elbow to the shoulder, and 80% around with the Velcro totally covered. And we have to note that this artery little reading right here has to be lined up with the brachial artery. So we're going to turn it a little bit. Want to make sure everything is good to go. Now the first time I pump it up, I'm going to be feeling his radial pulse, and whenever I hear, I'm gonna pump it up until I hear when I don't feel a pulse anymore, and then we'll go from there. So, okay. And let it go. Okay, so I stopped feeling his pulse at about 120. So now, this time, I'm going to listen for 2 sounds. The first sound is going to be the systolic, and that's the rate at which how hard or the force of blood is going out of the heart. The second sound is going to be the diastolic. That is going to be the rate in which the heart relaxes to open and have the blood refill. So, I'm going to add 20 points to the first time where I stopped hearing the pulse. I stopped hearing it at 120, so we're going to pump it up to about 140 and listen for those 2 sounds that I said. And it also is important to let the air out, not too fast but not too slow, to make sure it's an accurate reading. So our patient's feet are flat on the floor, everything is lined up, and we're going to pump to about 140 this time. We're also going to use the diaphragm of the stethoscope. Some textbooks says to use the bell, but for my hearing it's better to use the diaphragm. All right, are you ready to go?
Absolutely.
Okay. I'm going to place that right there. And we're ready to pump it up. Oopsies. Okay, looks like your golden standard yet again is blood pressure is 120/80. Alrighty, well thank you so much. Looks like you're healthy as a horse and you're good to go. Do you have any other questions or anything for me?
I do not, no.
Okay, great. Thanks for being such a good sport, Christian.
Thank you so much for your help.
That sounds like it's it for our vital signs video. So have a great day and thanks for watching.